Are you somebody suffering from cancer? Or maybe there is somebody in your family who got this cancer illness, and you are working hard for them to give them that quality of life, and you are struggling to find any answers related to cancer, how I can manage this cancer in a better way without having any side effects. What are their new medicines or new ways by which I can manage this cancer in a very natural way? If you're looking for answer to this question, this is the episode that is going to help you to get some clarity. Today, we have a special guest with us who is going to guide us on the cancer and how we can reverse that cancer. So, if you are new to this channel, please subscribe to this channel. My name is Dr. Nitin, and I help patients to get various information related to various health and medical conditions so that they can manage their health and wellness in a better way. So if you have not subscribed, please subscribe to this channel. And if you're watching, if you're already a cancer patient, and if you're looking for some kind of cancer solution, this is the episode for you. Please watch this episode till the end. With this, I welcome a special guest in today's session. We have a special guest from Daily Cancer Hospital. So she is Dr. Sujata Mittal, and she is a senior gynec oncologist, and she is having a special experience in lifestyle medicine and functional medicine. She is a not only just oncologist, but she is a holistic cancer coach, and she also has expertise in cancer nutrition, and she is associated with a specialty clinic and cancer reversal center. I welcome you, Dr. Sujata, to this
Thank
special
you.
episode
Thank
of
you.
Health Talk. Yeah. Dr. Sujata, first of all, thank you very much for coming to this special episode and coming to guide us on cancer and various questions related to cancer. So, Dr. Sujata, can you tell us something about what is cancer reversal? Because there are millions of people who are suffering from cancer, and day by day they are fighting for this battle with the cancer, just to improve their lifestyle, improve the quality of their health. And on the same side, there are medical experts and researchers who are also fighting their own battle to find various solutions and treatments modalities for managing the cancer. So, among all these spaces, I want to ask you about this cancer reversal therapy. Can you tell us something
Right.
about this?
Yes. Thank you, Dr. Nitin, first of all, to call me and have a discussion on the very important subject that is the cancer reversal and how we can, along with the conventional treatment, what else need to be done so as to cure the cancer. See, in every disease, we are looking for the cure, basically. And for the cure, the scientists are also working and newer, but they are working for the newer and newer drugs. And if at all latest of the medical research, if you have ever or the people must have looked on, they are exploiting the body cell only. For example, in treating different myeloproliferative disorders or different types of cancers, they are taking out the blood and separating the lymphocytes from them and injecting them back into the blood. So this means the body has a capacity to heal itself. This clearly means that the body, and if we just look at the body, then we know this thing very well. Science also knows that the liver, it can rebuild itself within a span of 6 weeks. Our bones they rebuild themselves within a span of 1 year. So like that, it is the cancer reversal is that your body has got the capacity to heal itself, to reverse back, to go to its normal original position, provided that you give what the body wants, provided you give that what exactly the body wants. Because it is now 100% understood that the 90% of the cancers, they are the lifestyle disorders. And only the 10%, 5 to 7% of the cancer, they are the genetic, because of the genetic disorders. Remaining are the lifestyle. For example, we know this thing very well, that the cancer lung is a disease because of this excessive smoking or the pollution, the type of the environment we are living. So the first thing when you go to the cancer specialist, they will tell you to stop smoking totally. Suppose you are taking lot of chilies, they will, in stomach cancer, they will tell you that stop taking lot of chilies, avoid alcohol, and stop taking antacid for the long term, and all those things. So this means that there are certain factors which are causing the cancer, and you have to remove them. But beside removing the factors in cancer reversal, we provide what the body basically requires. Body is made up of the cells. So what exactly the cell requires so that it can function properly, if we provide it, then the body starts healing itself, and then we can come back to the natural health, the way we want it. So there's a lot of components, but there are 4 major components of the reversal. That is the physical health, mental health, emotional, and spiritual. Our allopathy is only physical. It gives you medicine. It asks you to eat whatever you want to. It doesn't talk about the sleep. It doesn't talk about the meditation. It doesn't talk about the stress management at all. But exactly, if you go for the WHO definition of the health, it is physical, mental, emotional, and spiritual components. And they should be in the balance in a body so that you can combat the cancer. So the cancer reversal is a mechanism where you bring out the balance in the major of these 4 aspects of the life. Because if you are stressed, we know this thing, the hypertension is because of the stress. We know this thing, the obesity is the starting point for all the diseases, including cancer now. So we need to manage the obesity, we need to manage the stress, we need to exercise on a daily basis, without which the nutrition won't be absorbed properly. So cancer reversal is about balancing these 4 aspects of majorly balancing these 4 aspects of the life.
Okay. So, Dr. Sujata, can I say that cancer reversal is a more of a holistic cancer treatment, and in this we are using the body's natural own mechanism to fight the cancer?
I don't think it's a holistic, it is a scientific. Now, a lot of research has gone into it, and a lot of papers have published that what is the role of the diet, what is the role of different things. Suppose, what is the role of exercise, and even the research has gone, lot of research. I can tell you the papers also, when they say, where they have found that if you meditate, your certain vibrations, your energy levels increases, and you are able to you become a better person, you become a calm person, because aggressiveness in your that decreases. And we know this thing, that when person is aggressive, certain types of the hormones, especially if we call in the medical language, that is the sympathetic system overstimulate. And when the sympathetic system is overstimulating day in day out, then it causes a vasoconstriction, it releases particular hormones, which causes in turn they aggravate the inflammation, and inflammation is again the starting point for the cancer. So this is the so this particularly, if you say ki it is a holistic, no, because a lot of science has worked on it, and every aspect, including diet, nutrition, meditation, exercises, and stress management, a lot of papers are there. So it is a scientific. Now even a lot of doctors, I've even, for example, recently I got a patient from PGI, and they've advised them, that particular patient, not to take the milk. So now doctors are becoming aware of the role of the diet and nutrition. So it's not holistic. It is a partly holistic, you can say, in the layman, but it is a scientific now.
Okay. Okay. Dr. Sujata, when it comes to cancer management, particularly in the allopathic field or in any other alternative therapies of the medicine, uh, doctors typically use the conventional or traditional protocols or treatment modalities. So, how did you come across this cancer reversal therapy, and can you tell us some brief journey about like how you got introduced to this?
Yes, I was working actually, being a cancer specialist, I've been working in the different hospitals. But the most importantly, when I was working in a district level cancer hospital, which partly belonged to me also, and we were overall in charge, then I saw that I noticed, it was a stark notification to me that most of the cancer patients going to the medical oncologist, their weight went from 55 to 35, and even then they went on giving the chemotherapy, and the patient became lean and thin and totally ill. Then that worried me. Where is the weight gone? How the cell will function? This patient is having so much of the complication. How he or she can tolerate the chemotherapy? So when the weight loss from 55 to 35 kg had gone, and still there wasn't any response in the many of the patients I saw, they were not responding, but still we were giving the chemotherapies and radiotherapies and all those things. Patient were not able to eat properly. Rice to feeding was being done. That caused me to think over what we are doing and how the patients are going to tolerate and why we are not giving good results in the cancer. So that led me to think and rethink. And plus, at that point of the time, I had my personal problems in the form of severe osteoarthritis also. And I was not responding to I was taking Brufen 600 milligram QID. And I went to the best of the orthopedics in Delhi, and they advised me at very young age, at the age of 52, get the knee replacement surgery. And then when they told me that your knee, once you go for the surgery after 15 or 20 other years, you might need again replacement. That made me think what I'm doing. And then all whatever I saw with the patient, I thought there's something beyond this. It's not all about the medicine only. The body has much more capacity, because I used to, when I was young, my mother used to tell us stories and different type of the things. And from that, I started thinking. And then I went to Isha Foundation. From there, I learned the cancer. I don't know whether most people must be knowing about Sadhguru Jaggi Vasudev and Isha Foundation. From there, I learned about the diet and how especially the asanas, they work on your body, and how they work on not only the body, then the mind. And then there were certain startling revelations and changes in myself. I didn't had, that was way back in when I was 45 or 47 years old. Now I'm 63 years old. So I'm not having my knee replacement. I haven't got it done yet. But I'm without painkillers. I still, it's not 100% gone, but I don't need surgery at all. So that is the way my journey started. Isha Foundation was the main milestone. And from then I started doing I did my nutrition courses, functional medicine courses, and applying those things on my patients, and saw the wonderful results. So that was the journey, and still continuing. It's still continuing.
Ma'am, I should definitely say that whatever activities and efforts you have taken, it's definitely showing up, because irrespective of your age, your energy is really tremendous. And I'm sure you are using that energy in your patients, and they are
Yeah.
also benefiting from your therapies. So
Yes.
that's
Yes.
really nice. As the awareness around cancer is increasing day by day, patients and their family members, they are getting more aware. So they are also looking for some alternative therapies, and particularly like how they can manage cancer in a more natural way. So can you give us some clarity, like how this cancer reversal is different from the conventional therapy cancer treatment?
See, I don't say that you should not take the conventional treatment, but no, mostly I get the patients when the doctors, they have said no. I get the patients from Tata Memorial Hospital also. I get from Rajiv Gandhi Cancer Hospital, which is nearby, from Jaipur also. So, and at that point of the time, when they come, when they have received 20 cycles, recently I had last month only, I had a case of CA ovary, and she had major surgery twice, then chemotherapy, and now she had received 24 cycles of chemotherapy, and then they said no. At that point of the time, when such patients come, it becomes very, very difficult for us to treat them, because lot of already they are broken, physically, mentally, emotionally, and everything. They don't find hope at all, and to work on such a person is a very, very difficult work. So I don't say that you should leave the conventional therapy, because it is a part of it is a scientific proven method and all. But along with this, if you start managing your life, that, because as I told earlier, that the cancer is a lifestyle disease. So what you have done since past 25, 30 years to your body in the terms of your diet, because diet now a big subject of the gut health, gut dysbiosis is coming. So what you eat, suppose you are eating a burger and drinking the cola, and then you think you won't get anything, you will be always healthy. That's you're lying to yourself. What you will put inside the body, suppose you're putting the garbage, you are going to throw out the garbage, in the terms of health, also in the terms of emotional outbursts, also in the terms of your stress management, and in the terms of spirituality also. So what I suggest is that everyone, whosoever is having the disease, especially the cancer, they should immediately start uh, changing their life in change their life in a 360 way. Start from the diet, that is a nutrition. Start from the diet, that is a nutrition. Then manage physical exercises. I have seen personally, as I told you, that how the Hatha yoga, especially the asanas, Surya Namaskar, it affects you. Start if you are fit, because once you are taken so much treatment, just now, as I was telling you, that 55 or 58 years old, 24 chemotherapies, with so much of the abdomen, she cannot do anything. She could not move even. So to put such people in going for the physical exercises, that becomes very difficult. So once you are diagnosed, you change your life, you change your diet, you go for the good amount of exercises, you take good amount and you become go nearer to the nature, manage your stress, then your effect of the chemotherapy, also your outcomes will be much, much better. Plus, beside this, if there are already studies published that, for example, in my patients, I give high dose IV vitamin C just before chemotherapy, even before surgery and during the radiotherapy also. So the toxicity effects of the chemotherapy, surgery, and radiotherapy, they decreases remarkably. So if you combine all these things together at the start of the treatment, the life longevity plus your outcome will be much, much better, rather than coming at the terminal stage when every doctor has told you no, because by that time your body has become so much toxic because of the chemotherapy. See, they are all chemicals. Radiotherapy, it is giving you oxidative stress. And chemotherapies, they are all chemicals. And emotionally, patient is gone. So to move them at that time, you do this, you take life, you don't eat this, that becomes very difficult. So it is always better to start at the point, as soon as you are diagnosed, you start with the diet, you start changing your life, and start doing the exercises, and your outcome will be much, much better.
Yeah, yes. I completely agree with you, Dr. Sujata. This lifestyle management, it's not only helpful for just for cancer, but in all other major conditions, chronic diseases, it's
Chronic health
definitely
condition.
it's definitely useful for like managing your day-to-day routine, having control on your nutrition, the food that you eat, the physical activity that we do, all these have cumulative effect on our health. So if you are watching this video, do not wait for to develop this kind of condition. Start having this healthy lifestyle from today itself. You do not have to like wait when I will develop this kind of condition, then I will do changes in my lifestyle. No, you need to do lifestyle changes today so that you can prevent this kind of condition. So, Dr.
Can I
Sujata,
tell you, can I interrupt you? Can
yes,
I
yes,
interrupt
yes,
you?
ma'am. Yes, ma'am.
One thing is very important and interesting, that because I'm a nutritionist, whole plant-based nutritionist also. So when I was not aware, I had not done my courses. So if patient would have come to me, I would have told them कि नहीं नहीं ये कुछ करने की जरूरत नहीं है. So the same thing is right now happening with the most of the doctors. If you go to your oncologist, नहीं कुछ नहीं करना, because for example in my patients I tell them to go for the juices, fresh fruits immediately after the chemotherapy. Normally after chemotherapy the doctors will say कि boiled खाना ही खाना है, कोई fresh मतलब कोई fruit नहीं खाना है आपको, fresh कोई juices नहीं लेना है. Similarly, patients having cancer and diabetes, they will say big no for the fruits. और हम लोग जब मैंने सारा अंडरस्टैंड किया, then I came to know कि fruits में जो carbohydrates हैं, they are complex carbohydrates and they don't affect your metabolic, मतलब they don't raise your sugar at all, and rather they are the need of the body. So what happens normally right now is a challenge which I'm also facing, that as soon as the patient goes and tell their doctor ki hum we are changing our diet also, we are changing the lifestyle also, and we will do this thing, they will say ki no, diet, whatever we are telling, mostly the doctors are telling ki aap high protein diet lijiye. High protein is a very, very misnomer, because it increases it makes your body more acidic. They ask them to take non-veg sometimes if the patient is taking non-veg, but mostly they will ask them to take the lot of milk products, especially the cheese. And now the milk has become a silent killer. It has become a silent killer. The reason I can explain you if time allows.
Yes,
But so the thing is that you should not listen about this regarding this thing about the diet and lifestyle and other things to your, either you discuss or you don't discuss. But if they're saying no, you should go for the management, lifestyle management, and diet and nutrition and supplements also doctors will say no. That is a very big misnomer, because there are certain studies they have come up which says ki no, supplements are not good. Certain studies they are saying yes, you should take them. So the best decision is see, normally I tell all my patients, because they come to me in the last stage, you have tried everything, whatever your doctor has said, and now you're coming. So why don't you do what am I telling you and see, experiment with yourself. So same with every patient that they have to experiment in certain things. What's the fun in coming in the last stages and when the doctor says no? Yes, sorry.
Yeah. Okay. So, ma'am, I have just one question in this continuation. That like when you're talking about this kind of experiences, you need to break or something.
Okay, no problem.
So what I'm trying to understand is why do you think that we can see this kind of response from the doctors? Is it the resistance or is it ignorance or it is something else to this kind of thought process?
Yeah, there's many reasons. For one most important reason is that we are not taught nutrition at all, and we are taught that the body is only physical. है ना, liver अपनी जगह है, heart अपनी जगह है, it functions like a machine, but body is not machine. Okay, so the nutrition we are not taught. We are not taught about the stress management. Everyone must have heard that even the doctors are undergoing a lot of stresses, and even the doctors while studying, doing post-graduation, MCH, super specialty, they are committing the suicide because they are not able to tolerate the stress. So body is not a mechanical thing only. It's not a physical. It has got an emotional component, which we are not taught at all. We are taught about the psychology and all those, but we are not taught about the tools, how to handle the emotional stress, and what is the role of the spirituality in the body, and what is the role of the exercises, we are not taught. So that is why, and we just rely on the science, clinical trials, and in clinical trials also we see a lot of failures. Suppose see a breast, they have done the studies, 1,000 patients, there were at least 200 300 patients, they don't respond, but in totality we will just see that 700 patients have responded, so that this treatment is good. But what about the 300 are not, they have failed because something might else be working for them, which is not routine, which this particular treatment has not offered to these 300 patients. So what are the factors why those patients have failed? We are not, clinical trials are not looking into it, into that field at all. So that is why the resistance is there, because we are not taught the nutrition, we are not taught about the emotional management, and we are not taught, and this is very clear. Now the studies have come that CA breast, for example, I'm talking of CA breast because CA breast, CA endometrium, CA prostate, they are becoming a major this thing, that the female in a CA breast, those who are utilizing certain tools. Tools means, so for example, I'm following certain kriyas offered by Sadhguru, like Shambhavi Mahamudra. So those who are using certain tools to manage their emotional stress, to be much healthier, then their outcome is much, much better than those those who are not using any tools to manage their life properly. So that is why the resistance, because we are not taught, we are not aware that the bodies have different components, and we are too scientific. We only rely on most of the doctors, 90% of the doctors, they only rely on the science, on the clinical trials.
So, Dr. Sujata, like when it comes to this kind of cancer reversal therapies or treatment, can you tell us like who should among the patients, who are the patients who should choose this kind of cancer treatment, cancer reversal therapy? Can you tell us some ideal patient profiles who should go for this kind of treatments?
Every patient should go for. I'll tell you, if you people want, I can connect to few of my patients, those who have attended my workshops, because I do workshop for them. Every patient is a potential candidate for this, because it will improve your outcome to a great extent. Even if you only, because here I give certain IV therapies also, as I told earlier, that before starting the chemotherapy or while taking the radiotherapy, so that improves the quality of the life also, well-being also, and enables one to tolerate the side effects of the chemotherapy and radiotherapy. But those who are doing the workshop, there's a girl, she had a sarcoma, and sarcoma is a very aggressive tumor. So normally we advise whole plant-based diet also. So that girl, parents attended, and they went for 3 months totally on the fruits and raw, only for 3 months. And it's past 2.5 years. The doctor has told them that in spite of the best of the treatment, she is a Pune based girl only, and that she will survive most maximum to 16 or 18 or maximum 2 years. And she has started going to the school, and she's playing, and still plant based diet. Similarly, one of my MBBS students mother, she had a stage 3 cancer endometrium. So endometrium, ovary, they are all hormone-based treatment, hormone-based cancers. And sarcoma, totally aggressive, one of the aggressive. And that lady, in spite of stage 3, only surgery done, she was advised radio chemo. She hasn't taken treatment any, and she's only raw. She doesn't take even a cooked food, tablespoon of the cooked food also. And it's almost 2.5 to 3 years, she's fine. So what I suggest, what I tell everyone, that it is not that particular, there's any profile for that. Everyone should have because everyone should have this sort of the lifestyle, because it is a healthier lifestyle. What we are telling you to have the healthier lifestyle only, and it is good for everyone. But definitely, because now the adenocarcinomas are increasing, so the hormone dependent cancer, they will respond much, much better than the routine cancer, squamous cell carcinoma and sarcomas. That is there.
So, is there any difference considering the stage of the cancer in the response?
Earlier you come better, it is always better. Stage 4, as I told you, it becomes very difficult to manage this, because by that time the disease has metastasized. Exercises, meditation, because meditation, you need to sit properly. And if you are already in a crippling condition, you cannot focus your mind. The basic thing is, in meditation I'm talking of. And even then, the stress management becomes very difficult. So earlier you start, once the stage 1, people are their physical balance is good, and mental balance is also good, and they're willing to do whatever is being told. By the end of the disease, stage 3 and 4, they are monetary also, a lot of people, they will become heavy. So my suggestion, if once it is diagnosed, immediately you start off the treatment. That is always better, whatever the stage once you are diagnosed. In India, mostly many of the cancer, they are diagnosed in stage 3 and stage 4 only. So we have to start that treatment. That is no doubt about that.
Okay. So, as in general, for cancer, we can say that earlier the detection will help, and earlier treatment start would help patient in a better way.
Yeah.
As they are coming in late, it becomes difficult to manage this kind of condition. Okay. So, Dr. Sujata, are there any limitations of this kind of cancer reversal therapy that you have noted or you have observed?
Limitation is only that if you come after the taking the treatment, Hana, and your doctor has said, see, past 1.5 years, I'm getting the patient, those who have taken the treatment, allopathic treatment, now young patient, 45 to between 45 and 65, and they've been said no, and then they come. At that point of time, I have really tried very hard, the few of the patients. One is that they are financially broken. And at that point of time, it's not only the diet alone or the exercises or meditation will help you. We have to give certain therapies also, and those therapies also incur cost, and that too on the daily basis. So the limitation only is this, that you should start it earlier. Don't come when your doctor has said no to you, because financially you are broken. And even the treatment, functional medicines which we are giving, for example, we are giving alpha lipoic acid, so we don't get it in India. IV curcumin has come in a very, very big way. Orally, we are advising the patient, but IV curcumin, and it is not available. Although the curcumin, turmeric is going from India to Germany so that they can purify and make it a IV combination, give it as an IV. It is not available in India. And when you get it from Germany, the cost is very high. So only limitation is that don't come when the doctors have said, and because you have received so much of the chemicals, that when most of the patient I want, whatever the treatment I have given, they detoxify. And because of the detoxification, because the chemicals are moving out, the condition initially worse, and they leave the treatment. That also happens. So it is always from my side, I've started taking now precaution that I don't want to treat such patients, because only the diet. I've stopped giving the chemotherapy diets, IV therapies to such patients. Those who come, only diet, lifestyle modification, and lot of meditation, because detoxification has become a much, much major problem with such patients, because body loses chemicals like anything. And once the body starts eliminating the chemicals, the suffering is more. That is there.
Dr. Sujata, suppose say some cancer patient visits to you, what is the typical flow and how do you manage this kind of patients? How do you support them?
Can you repeat what you are asking?
Like, what is the process for like somebody visits to you for this kind of cancer reversal therapy? What is steps or the process that the patient needs to undergo?
See, first is the testing. I normally advise the testing, basic testings. Mostly the doctors in allopathy, we are not asked to look for the vitamin B12, vitamin D3. I go for the vitamin B12 and vitamin D3 levels, and certain other levels, to know how much is the inflammation. And latest, some testing, one of the testing regarding the chemicals present in your body, aluminium, mercury, lead, and all those, they have come. The lab laboratory, so we do that so as to know the toxic load of the body. And then first thing which I normally do is the purging. Purging means clean the colon, which is a concept of the Ayurveda, because if your gut is not healthy, then your body cannot be the healthy. So we first main is that you, and most of the people resist it. Let me tell you, no one likes to give the enemas and colonic wash and all those, but it is a one of the basic steps to clean the gut, because it is loaded with the most of the patients are constipated after chemotherapies or radiotherapies and whatever they have been taking. Mostly every patient by the age of 40, 45 in India, the type of food we are eating, we are constipated. So the gut clearance is one of the most important thing. And depending upon their choices and affordability, we start with the diet management. Along with the diet, we tell them, depending how much they are age, what is the age, what is the physical mobility, and all the physical mental strength. Also, we advise them few of the exercises which they should go. If their person is active, I immediately ask them to have a proper yoga instructor to go for the Surya Namaskar. But most of 90% of the patients are not that fit. So simple all body these joint exercises, simple exercises, and deep breathing exercises. Pranayama, you can tell them. Or if they are not, they don't like it, then we have got the spirometry, 3 balls there. They have to, so that the lungs expand. Most important is that lungs expand, because once the condition of the lungs improves, even the condition of the gut improves. And we know this thing very well, that the cancer cell, they die in excess of the oxygen. So we want to improve the oxygenation. So the first is the testing, then we go for the gut cleaning, then the diet. Totally 100% change in the diet is to be there. They have to eliminate, if they are coming in the terminal stage, then they have to totally change their diet. They have to immediately eliminate. In certain patients, we can advise them to go slowly. For example, most of the people are not willing to leave the tea, and we don't want them to have the milk at all. So this is one of the most important aspect which I'm facing the difficulty. For example, like this. So the diet modification, deep breathing exercises, then we teach them certain meditation tools to keep themselves calm. So that because constantly the mind, they're so scared, na, constantly they think ab kya hoga, mera ghar kaise chalega, मेरे बच्चों का क्या होगा, because everyone has got the some of the those problems, financial. तो ये है, तो ये करके if they are willing, then we go for the मतलब therapies. If they can afford and the toxic load is not so much, then we go for the different therapies. And the therapies, they are very intensive, means almost alternate day, high dose IV vitamin C and alpha lipoic acid and whatever the body needs depending on the test. That is the way. And we measure with the test only. See, the best way is to measure the test. And we definitely give the ozone therapy to certain patients. We give the ozone therapies also. HPOT is also there. I don't have the HPOT facility, but HPOT, ozone, I give lot of patients, I give ozone, which immediately improves their oxygenation level and hemoglobin levels. Right. And supplements also, high dose supplements, oral.
Okay. Okay. So, Dr. Sujata, if say some listeners of this video or some patient wants to meet you, how and where they can approach you to discuss about this kind of cancer reversal therapies?
If they want, you can give my number to them, and I will share one brochure. I'm doing a workshop next month for the cancer reversal, touching all the aspects which I have discussed: physical, mental, emotional, and spiritual, supplements, and so. And we will be discussing in that workshop that how one can read their reports. See, reading their reports on simply on the basis कि जो उसमें लिखा होता है कि minimum to higher level, that is not the way correct way. So reading their reports, we discuss, I tell each and everything. So every tool will be discussed in the workshop. So you can give my number, and then I've got a Facebook page also, Jeevan Disha, by the name of Jeevan Disha. So on the platform of Jeevan Disha, I do everything.
So if you're a cancer patient or if somebody in your family is suffering from cancer, and if you want to get some personalized consultation from Dr. Sujata,
yes,
or if you want to know about cancer reversal therapy, I will provide the contact details in the description section of this video. And from there, you can book your appointment with Dr. Sujata. So for the audience of this podcast, if you are suffering from cancer, or if you're somebody in your family or your friends is suffering from cancer, please share this video with them so that they also clarify some of the doubts related to cancer and how they can manage their cancer in a better way. Not only just treat the cancer, but improve their quality of life. So please do share with your friends and family. And if you have any questions related to cancer, or even cancer treatment or cancer reversal therapy, you can ask your questions in the comment section, and we'll be replying to your questions if you have any. And please subscribe to this channel if you want to know about more about managing your health in a better way, or if you're looking for particular management of any particular chronic condition. Because on every episode we invite various experts from the healthcare and medical field, and they share about their experience, they share about their knowledge about managing those medical conditions. So please subscribe to this channel. That's all for this episode. Dr.
One
Sujata,
thing, can I
yes,
can I
yes,
interrupt you?
yes, ma'am,
I
yes,
want to
ma'am.
show this book because it's very important before you consult or go yourself, go and read certain books. This is a book, very good book, Anti-Cancer, written by Dr. David Servan. He himself had a brain cancer. So beyond therapies, and then there is a one more book which Dr. Nitin will can share with you. The name of the book is What is Missing from Your Medicine, which doctors are not telling you, by Dr. Ray Strand. He's an MD doctor, and how he is treating his patients, which other doctors are not being able to tell. And he has written about all the chronic health conditions. And his journey started with his wife. She had fibromyalgia, which no other doctor could treat. So he has given all about the supplements and what one should do, and with the basic understand. And another latest book has come by Dr. Mariah Stanek, What is Missing from the Medicine. So I'll give the name of these books to Dr. Nitin, and he can share with you, and you should go through them and then understand, and then later on, whatever the way you, life is your choices, are all what we choose, we'll get there. Okay.
Thank you, Dr. Sujata, for sharing the book recommendation. I'll definitely share the links of and the books of names in the description section of this video. And I really thank you, Dr. Sujata, for providing your valuable time and guiding us. And I hope
My pleasure.
many patients will definitely benefit from your guidance and from your treatments. Guys, that's all for today's episode. We'll meet in next episode with another guest, with another different medical condition, another topic. And that's all for now. Signing out, that is Dr. Nitin. Bye bye.